The next is Ivra Cahar. Originally, Deputies Matthew McGrath, Carl Nolan, Michael Healy-Ray, Sean Canny, Noel Grealish, Michael Collins, Richard O'Donoghue, Patrick Tobin and Peter Fitzpatrick were nominated it. As far as I can ascertain, there are only 5 of those members in the House, and with your cooperation I will try and accommodate each of you to the extent. Originally it was to be a half a minute each, so we'll start off in the hope that we can do a minute each. Deputy Matthew McGrath.
And Kate O'Shees, I want to thank the Count Caller for allowing this very important topic this evening, and apologise for the deputies who weren't here. Some pulled out Peter Fitzpatrick in order to give us more time. There appears to be, Minister, the reaction of doctors who are carrying out delayed term abortions in Ireland make for grim reading. One doctor describes the carrying out of feticide as stabbing the baby in the heart. Others said it was brutal, awful, and one revealed that I remember getting sick out in the corridors afterwards because I thought feticide was such an awful procedure and so dreadful. We tried hard, many of us deputies on the pro-life side, during the committee in 2018. We put forward amendments for pain relief, and Minister Harris was pretty dismissive and ignored all appeals and told us this wouldn't happen, couldn't happen. We knew under international experience that it would happen, and it is happening. It's a shocking situation in our country today, and I think something has to be done about it. It's just not acceptable. It's unspeakable. And they are the doctor's words I quoted there.
Deputy Carl Nolan.
Count Corla, I just want to raise 2 very brief points. We were all given assurances that there wouldn't be an issue with babies being born alive. We brought that very issue up here and we asked what was going to be done in that instance. We were dismissed, and we now see that there's evidence and facts coming to light from GPs and doctors themselves. Now, what I want to know is what you're going to do about this, and it's shameful that the Minister for Health isn't here himself. And my second point is there's now conflict among doctors in terms of diagnosing fatal fetal abnormality, and also in terms of the palliative care for babies born alive. And I want to know, what actions is government going to take? Because we will not allow this to be swept under the carpet. It's barbaric and shameful.
Deputy Sean Canny.
And I just want to add my support to this topical issue. It is very frightening when you see a report that has been produced, and I think the onus is on government, the onus is on the Minister for Health to make sure that this report is looked at, and it is an independent report. It's not been commissioned by any particular group, and the findings are actually horrific when you read them. I won't go spelling out the wording that's in them, other than there seems to be a huge amount of anomalies left for the provision of pain relief and palliative care for babies who are born and who were aborted but are still alive. And I think it's something, when you think about it, it is something that we really need, Minister, to look at and make sure that our children are treated with dignity. Thank you.
Thank you, Deputy. Deputy Patrick Tobin.
Minister, an unborn child is a living individual human being. They are as human as you, they are alive as you, and they are as individual as yourselves, and that's according to science. And yet, under your government currently, late-term abortions are being carried out on unborn children, and pain relief is not being used. Minister, on any level of humanitarian basis and understanding of society, how can you stand by this? When we put motions in front, or amendments in front of the bill when it was rushed through in 2018, Fianna Fáil, Fine Gael, Labour and Sinn Fein voted against motions to ensure that pain relief was included in this regime. I put a question to the Fianna Fáil Minister, Stephen Donnelly, just a week ago, asking him to ensure that pain relief would be afforded to children when they're being aborted in this country. Stephen Donnelly, the Fianna Fáil Minister for Health, refused.
Deputy Michael Collins.
Thank you very much. The people of Ireland voted for abortion a couple of years ago, Minister, but no one ever thought that there would be 6,666 abortions in 12 months. And I met so many people that did vote for it, and I was stunned by this. But look, It is what it is. But the discussion today is about late-term abortions. What a new study tells us about late-term abortions and babies born alive after abortion in Ireland. A study from UCC recording the experience of 10 fetal medicine specialists providing abortions for fetal anomalies in Irish maternity hospitals was published in the British Journal of Obstetrics and Gynaecology. The reaction of the doctors who are carrying out these late-term abortions in Ireland make for grim reading, Minister. One doctor described carrying out the feticide as stabbing the baby in the heart. Others said it was brutal and awful, and one revealed that I remember getting sick out in the corridors because I thought the feticide was such an awful procedure and so dreadful. We were assured that this would never happen, and it is happening, Minister, and it's wrong. And it's a terrible, terrible wrong.
Thank you, Deputy.
And we would like complete clarity on this from you, Minister.
Thank you, Deputy. On Tara Slouch.
Thank you. Minister Donnelly is aware of the research article which the deputies refer on fetal medicine specialist experience providing a new service of termination of pregnancy for fatal fetal anomaly. The research article to which the deputies refer reports on interviews carried out with 10 fetal medical specialists in Ireland. Fetal medicine focuses on the management of high-risk pregnancies and include the assessment of fetal growth and the diagnosis of fetal illness and abnormality. The Minister is advised that in certain circumstances it may be necessary to perform specialised diagnostic tests on a fetus. For example, amniocentesis to check for certain chromosomal or genetic conditions of the fetus. Such diagnostic tests may be recommended, for example, if an earlier screening test or scan suggested that there may be an anomaly within the fetus. Regrettably, at times, these diagnostic tests identify conditions that have no known cure. Where a test shows that the fetus has a genetic or chromosomal abnormality, the healthcare team provide information to the woman concerned and discuss the options that are available to either continue the pregnancy or to end the pregnancy. The Health Regulation of Termination of Pregnancy Act 2018 sets out the parameters in which the termination of pregnancy may be lawfully carried out in this country. The Act permits termination to be carried out in cases where there is a risk to the life or of serious harm to the health of the pregnant woman, where there is a condition present which is likely to lead to the death of the fetus, and without restriction up to 12 weeks of pregnancy. Section 11 of the Act sets out the laws on access of termination of pregnancies in case where there is a condition present affecting the fetus and that is likely to lead to the death of the fetus before or within 28 days of birth. It requires the involvement of 2 medical practitioners. One must be an obstetrician and other medical practitioner of a speciality relevant to the diagnosis, care or treatment of the condition affecting the fetus. Both medical practitioners must certify their reasonable opinion formed in good faith before the termination of pregnancy can be carried out. It is essential that we are clear on the purpose of the legislation. It is to set out the law governing access to termination of pregnancy in Ireland. It is not to dictate the practice of obstetrics or of medicine more generally. Medical practitioners are always required to maintain professional standards and to uphold medical ethics. They are bound through professional regulatory mechanisms to deliver medical services in accordance with the best medical practice. The operation of Section 11 of the Act is supported by clinical guidelines developed by the Institute of Obstetricians and Gynaecologists. The implementation of the Health Regulation of Termination of Pregnancy Act 2018 has put in place a comprehensive termination of pregnancy service in Ireland. It allows us to look after women experiencing crisis pregnancies in this country rather than forcing them to travel abroad for care as we have in the past.
Thank you, Minister. A half a minute now for everyone. Deputy McGrath.
Again, I thank you, Concola, for giving us this very important topical issue. Minister, I think it's a shame that Minister Donnelly's not here. I met Minister Butler and Minister Robert wandering around downstairs. None of them would come in to answer it. I think this is shocking. What we want is a ban on late-term abortions, mandated care for any baby born after an induction, and pain relief for babies being aborted. I think that's a basic human requirement. It's barbaric. It's shocking. It's unbelievable what's going on. So I intend, with my colleagues here, to bring forward an amendment here to this barbaric legislation. We warned about it. We railed about it. We were dismissed as we were, nobodies. This happened all over the world, and now it's happening in our shores. It's hard to believe it. It's barbaric.
Deputy Carl Nolan.
Minister, it's disappointing to hear, from your scripted response, you haven't dealt with anything we raised here. We raised issues such as babies being born alive without palliative care, conflict among doctors, and also the whole issue of no pain relief being given. Even though the Animal Welfare Act 2013 allows vets to prescribe pain relief. And this is going unnoticed. You're almost justifying it with that sort of response. Minister, it is barbaric. And I mean, at the end of the day, this government is responsible. And the government, most of the members are back again. You're responsible for this. And you need to deal with this issue because it's not going to go away.
Deputy Michael Collins. Thank you, Concola, and thank you for allowing this topical debate. Minister Donnelly, you says, is aware. Is he aware of what is happening? Because if he is, you haven't got a proper response here, Minister. This is a very, very important issue here. And babies are being born alive, and there is being no pain relief administered to them. And you aren't answering that question to us here. And I will support any amendment that will help babies that are born alive and help them through it. But Minister, we warned that this would happen, and it is happening. And sadly, no one listened to us at that time, and now we've been proven right.
Deputy Sean Kenny.
Thank you, Concola. I would say the response is actually, it's an official response, but it has actually dodged the questions. And I think what I would say about it is quite simple. This is not something that should be treated as passing the responsibility to somebody else. We are legislators. We need to look at this. And I would ask the Minister to look at the reports, the report that was done. It wasn't anything other than a report and an interview with the people who were carrying out these procedures. So I would ask the Minister who's here, and I know well you will, bring this back to the Minister for Health. And I respect that, but I must say that the answer here is disappointing. Thank you.
Thank you, Deputy Peadar Tobin.
Minister, I know that you're reading a script at the moment, but you have an individual responsibility over what you say in this chamber and what's actually happening. And the hundreds of words that you spoke about add up to nothing. They mean business as usual. And it means that a boy or a girl who survives abortion, who is, Minister, a citizen at this stage of this country, is allowed to expire, potentially with no palliative care whatsoever, or no effort to protect their lives. And Minister, for you to come in and give that complete non-answer to such a shocking humanitarian situation in this country is absolutely so hard to listen to.
Minister, to conclude, please.
Thank you. In concluding debate on the issues raised by the deputies, I'd like to clarify again on behalf of Minister Donnelly that in order to provide a termination of pregnancy under Section 11 of the Health Regulation of Terminacy of Pregnancy Act 2018, 2 medical practitioners must have previously certified the reasonable opinions formed in good faith that the fetus concerned is likely to die either before or within 28 days. It is essential that we have in place a medically delivered, safe and regulated service for the termination of pregnancy for all those who require it if they find themselves in this unimaginably difficult position. In line with the will of the people, the implementation of the Health Regulation Termination Pregnancy Act 2018 allows us to provide women experiencing crisis pregnancy with access to a full range of services in this country. However, we must be very clear about the purpose of the legislation. It is to set out the laws governing access to termination of pregnancy in Ireland. It is not to dictate the practice of obstetrics. It is vital that our healthcare providers be assured that they can be confident in the decisions that they are helping their patients to make and providing the care their patients require. I just have listened to a lot of the very, I suppose, sensitive questions, and I don't have the answers for you, but I will actually bring your questions back to the Minister and to the Department, and I'll try to get a written response to the questions that you have put in the coming days. I don't have those answers here, but I will do whatever I can to get the Minister and the Department to respond.
Thank you, Minister Fein, and that concludes consideration of today's topical issues. We move now straight ahead to item